Floral would like to remind you Valentine's Day is Sunday, February 14th. Get your orders in early, as they will be open on the 14th for pickup only. Stevens Floral would like to remind you Valentine's Day is Sunday, February 14th. Get your orders in early, as they will be open on the 14th for pickup only. Stevens Floral would like to remind you Valentine's Day is Sunday, February 14th. Get your orders in early, as they will be open on the 14th for pickup only. Stevens Floral would like to remind you Valentine's Day is Sunday, February 14th. Get your orders in early, as they will be open on the 14th for pickup only. Stevens Floral would like to remind you Valentine's Day is Sunday, February 14th. Get your orders in early, as they will be open on the 14th for pickup only.
Okay, thanks for coming, and we do have a quorum, I assume.
We do. Do you want me to do roll call?
Please.
Okay. Charlotte Quist,
Yep, no.
Mike Clacken,
Yep.
Carla Whitinger, Megan Evans. Here. Rush Lott.
He's on.
Thumbs up.
He's
Okay.
muted.
Tom Rice.
There.
Nicole Hazelbaker.
Here.
All right. We do have a quorum.
Okay, and first and foremost, I'd like to thank Randy Shipment and Melissa and Tiffany for offering the library for the meeting today. We no longer, our tech at the courthouse moved to Washington, and she runs the Zoom and all that. Today, Chad is hiding in behind his legs.
Thank you, Chad.
Chad is running the Zoom. Thank goodness Tom doesn't have to, or the meeting wouldn't function. So, and I've just put it out. We've got the focus of this meeting basically is the community intervention implementation plan discussion. But we'll take it about 11:45. We'll wrap it up and then try to get through the hallways so we don't get, when the kids start shuffling, we're out of here. So, again, thanks, Randy, for offering the.
You're very welcome. We're happy to host you.
So, then.
There she
There's
is.
Charlotte.
Sorry, I didn't know where I was going. Right here. Can you sign in real quick too, dear? Please.
Oh,
Sorry.
we'll get you on
We'll get you later,
Back
okay?
there, buddy.
Right here. Thanks, George. I had Cindy helping me know. She Chase grandkids down here. It's been a long time since I was in this group.
I've never been in this building.
Anyway, we took roll call. We do have a quorum. We're ready to go. First topic on the agenda is public health update.
Yeah, well, I'm happy to say that our cases are staying down, which is so exciting. So all our mitigation activities and hopefully our vaccination process is working well and it's keeping those cases down. It's not to say that we're pretty sure that there's unidentified COVID cases out there. Our testing is way down. So I just want to say keep up the good work, community. It's been under 10 cases for several weeks now. Right now we have 4 active cases, no hospitalizations. So we've had 841 people recovered from COVID. So that's great. Do you want me to go into the vaccination?
Well, yeah, next topic is COVID-19 vaccination update.
Yeah, so it's been really exciting. We had our first community COVID vaccination clinic last Friday at the arena at the college, and it went exceptionally well. We had plenty of volunteers and everything. We're really ready for this inflow of people sitting in all these chairs we had set up, and it just went so smoothly. We didn't even use probably 2/3 of the chairs or anything like that. We had 4 vaccinators. It was a wonderful setup. The college had these curtains and stuff so we could partition off the areas that were for people getting vaccinated. It was just worked out really well. EMS had 4 EMTs there to do the health monitoring after the shot. Everything just flowed really well. We could have easily done 500 or more shots that day. We ended up doing 259 doses. Of those, 18 were the second doses. So we're starting, we're going to try to put all these second doses in these big clinics. I did most of those in my office in the month of January. So we're going to try to fit them into these bigger clinics. We do have our second community clinic scheduled for this Friday, again at the arena. We're making a few little adjustments. We don't need quite as many people, that kind of thing. We did receive 200 doses from the state. It was a little tentative there because they are not getting very much vaccine to send out to the state. I believe last week it was like over 13,000, and so dividing those all up has been pretty difficult on the state side. So I had a call on Monday and they said, well, we gave you 200 this week, but next week we're only going to give you 100. We know you have these clinics set up, but we're giving you, we were looking at allocating you only 150, but you can't break up the doses, so it's either 100, 200, 300. So she said, next week we've got to give somebody else more vaccine and you less. I said, okay, since we had them all organized, we were going to have to call 100 people and give them the bad news. Well, I got a call last night and they said, we think we're getting more vaccine. Don't cancel anybody yet. I'm pretty sure you guys are going to get your 200 for the 3rd clinic. So that was exciting news to hear. So I think it's going really well. Once we finish this 3rd clinic, we have 3 more community clinics at the arena, and that will be for the 2nd doses of these people we just did. So it's unfortunate that we can't do more because I feel like we're making such a small dent, but I guess we're making a dent, so that's good. Yeah, so hopefully sometime down the line we'll get a lot more vaccine and we can get that in people's arms in a really efficient way. So I don't know, do you guys have Nicole or Megan or anything?
I just have a comment. I know several people that went to the clinic and they all had rave reviews for you and your staff.
Thank you.
On how well it went. So I just wanted to pass that on officially.
Yeah, and we didn't have any severe reactions, which was great. So that's nice to see.
Now, before we step in on topic number 3, is there any questions or comments? Stephanie, do you have something? Go ahead.
Let's see. I just had a couple about testing and vaccinations and stuff. I was reading on, I don't know if it was Facebook or in the Dillonite, I don't know if it's Public Health or Beaverhead Urgent Care post, saying that even if you have really mild symptoms, we still want you to come in and get tested. I was curious what why are we pushing why are you wanting people with mild symptoms to still come get tested? I wasn't sure if that's something. So what are we, with the testing, I guess, they're encouraging people, no matter your symptoms or how mild your symptoms are or aren't, to still get tested.
Well, you can avoid future quarantines if they know you've been, been positive.
I think that's it too, and also we need to know so that if you give it to we want to avoid giving it to somebody else who might not have mild symptoms at all. They might be hospitalized. So we still very much want to know if people have COVID.
Okay, so it just kind of seems like it's just kind of to collect the data and make sure that.
Well, collect data, but also improve the overall health of the community, prevent it from spreading. We're doing pretty well right now, but we still need to keep up on it. And in fact, it's even easier now since we have fewer cases. We can really isolate people and hopefully prevent spread. When we're overwhelmed with cases, it's hard to keep up with it. But right now, I think we can really make a improvement if we just even not have one case that we know more than we usually would.
Okay. Yeah, and then at the last meeting, Sue, you had mentioned something about that the testing was down.
Yes.
Did you? Did you mean like is there less tests available, or there's less people coming through? No, it's okay.
Yeah, it's less people coming through. Yeah, we have plenty of tests now. It seems like it goes from one extreme to the other. We have lots of tests. Okay. And the one thing I do want to say, it's free. The testing is free at the community health center. I'm at a very small fee at the hospital, so it is available. You can get through it pretty quick. So it's just not very many people.
Okay. And then I just had one more question about once you're vaccinated with your second dose, can you still give COVID to somebody if you have it? Can you still transmit the virus after being vaccinated with the second one if you have it? I guess
we don't know. There's different kinds of immunity you can get from immunization. You can get sterilizing immunity where you cannot transmit it to anybody, basically, and we get that with measles. But there's non-sterilizing immunity too, where you're protected, but you can still transmit it to somebody else. But we just don't know yet. Okay. So we'll still need that data. It sounds like what I was just reading about the AstraZeneca data, which hasn't been approved yet, but may translate to the other vaccines, but they did show some decrease in transmission, like by 2/3. So you would suspect it would, but it's not known completely.
Not for sure. Okay.
Yeah.
Okay. Thank you.
Yeah, Chad has Kim Martinell. Kim, do you have a question or a comment?
Hi, everyone. Sue, could you answer a couple questions for me, please? So I actually brought my parents in for the vaccine, and I was very impressed. Super nice. It was very efficient, very well run. Great job. My question for you is, in these next blocks where you're vaccinating people, do they need to call and make a second appointment for their second vaccine, or can they come in the time that they came in originally? That's one question. And then my second question is, would you address that you will have enough for the second vaccine, the second shot with the same vaccine? Thank you.
Yep. So that's probably where we had a little bit of an issue there. We were trying to do vaccines to people who couldn't walk into the arena, so we were kind of going out into the car. And that process we're improving on this time. What's supposed to happen is with that little vaccine card, we were writing the same time down that they had the appointment for today in a month, in the next in that month clinic, and that was not consistent. So if people were not told that they had a appointment, they need to call so we can get that in there. I think we caught most of the people that came inside, but the people outside did not get that appointment. Did I explain that clearly? Okay, and then the second one, yes. So the state has held back the second doses. So if you receive the 200 first doses, they have held back those 200 second doses for you. So those will not get used or sent to anybody else. And they automatically get sent to us when it gets to that time. So yes, we can guarantee that. Right now, we can guarantee that.
Okay, Kim? Okay.
Perfect. Thank you. Thank you.
I don't have any others.
Chad has no more on the audio. Is there any other comments in regards to public health update or COVID-19 vaccination? Any comments from the... Okay, topic 3, the main topic of today. Community Intervention Implementation Plan. And I'll just turn that over to Sue and Megan, and we'll start. Go ahead.
So as I said before, this is a required public health emergency preparedness deliverable. And what I could get out of it, and I did call the state because I was a little confused, is they just want a short written up plan. It doesn't have to be anything fancy or anything like that right now. Is how did we focus on these 3 goals using COVID as a very, very good example of what we need to do? How do we slow the transmission of disease? How do we minimize morbidity and mortality? And how do we preserve healthcare, workforce, and infrastructure functions and minimize social and economic impacts? So those are the 3 goals that we were supposed to look at. Using non-pharmaceutical interventions, which is what we've been doing, wearing masks, social distancing, and hand washing, because those were the only tools we had in our toolbox. What went well? What didn't go well? What would have worked better in implementing those kind of things at our local level? Obviously, we can't change what happened at the state or the feds, but how could we have done those things better? So some of the other things that might be under the non-pharmaceutical intervention are the isolation and quarantine, restrictions on movement, travel advisories or warnings, the environmental hygiene, washing and cleaning all the surfaces down, and then the closure of schools, businesses, and public events. So those are also within that guideline. So what could we have done better? What would be our trigger points looking back now that we needed to do that? What kind of roles do agencies play, such as public health, hospital, government, schools, etc.? What agreements are needed? What other meetings should we have had that we didn't have? Or what meetings didn't we need? Did we set up instant command when we should have? Should we kept it? I mean, all those sort of things. What about our economics? That was a huge issue. And how do we reach groups that are at high risk? What about the public acceptance of MPIs, of mask wearing and social distancing? How do we monitor and evaluate? How do we balance public health benefits versus social costs? So just thinking of those kind of things, I think we can just have a discussion is what I was looking at. And this, if you got a chance to look at this, this had some good information in it as well. So I guess I'll just kind of leave it there and just hopefully we can have a good discussion.
Could I just say discussion on goal number 1 first? Is that how you want to do it, or all together? Yeah, goal number 1, slow transmission.
We could try it just to do it on per goal.
Just so you got a topic.
Yeah.
Go ahead, Mike.
Well, I did some research trying to answer a lot of these questions. I'm going to give you a handout. I'll give you one for the record. Okay? So, I think I even knew if you wanted it.
Thank you.
Thank you.
Yep. Oh, there's more over here. where this is coming from is I went and grabbed the CDC numbers just last Friday or Thursday, I can't remember. And I went through and I got the population divided for the states. All they did was the states. I was not going to go through counties again like I did with Kansas. But I did the states. The numbers that you're seeing there is two numbers. One on the left side is cases running 7-day average. We're looking at each day. And it was also adjusted to 100,000, which means you take whatever number, whatever cases, or how many deaths for that day, and then you divide that by what the population in the state, and multiply that by 100,000 to get the numbers that way. And that's what all of these, I just showed you here, there's 4 states at the beginning: California, New York, Texas, Florida. Everybody was saying Florida for sure. Texas even had mask mandates. Florida did not. California had mask mandates along with really restricting what people get to do. Texas had a mask mandate, but they didn't restrict as much. And if you start looking at all of them, especially the numbers, you're seeing that, at least lately, nothing really seemed to change between any of the states. And if you go, and I looked at all 50 states, and nothing really seems to, there's no difference between any of it. Between the ones that are totally strict, shutting things down, losing businesses like California versus Florida, who pretty much left it all open, there is very little change, if any. And statistically, there was no change. So I can't say that progress of the disease is what I'm trying to say on that. And I went and even looked at all the states. The last parts of this are tables. And I went through, one I just did just for me to fun. I went through all the states that voted for Biden, and I looked at all the states that voted for Trump, and I compared them. Okay, now not all of them, they're different. They're all mixed in there. And what I came up with was there was no difference between the two. So there's the same number of deaths, the same number of cases, all of that. I mean, statistically is what we're talking. That's all you can talk. Then I also went and dug up all the states that have face mask requirements versus none. There isn't that many out there that had none. But when you look at the data, there's no difference between it. Statistically, there's no difference. So when we're asking here, they're asking us to answer questions here on what worked. I don't know if you can say that anything that we've done worked. Just because I have Montana in there, if you look at the map of Montana, which is right at the end of the grass, when you look at when the governor threw in the lockdown, that actually, if you look at the date, actually increased and then it decreased. I'm talking about how many cases. So those are always the solid lines. I'm not talking deaths on that. But then they put in mask mandates. As soon as he put in mask mandates, the number of cases started rising. So you can't really say that that actually helped, of doing that. So the number of cases that came about as soon as he put the mask mandate in, it started going up more.
You're painting with a pretty broad brush there, Mike.
But it did work. This is what I'm trying to lead in here is we got to be very careful. If you're going to say all this stuff worked, I mean, it might give everybody a warm feeling that it was working, but I don't think it worked. Or I don't think you can show anything on how it really worked number-wise.
Well, I think one of the problems with taking statewide populations with this kind of an analysis and then making any kind of an assessment that this is attributable to either social distancing or mask mandates is really stretching it. You would really have to look at the numbers a lot tighter by a more controlled group. You know, I really appreciate that you've put this much work into it, but I really...
And I would agree. There is none of that data out though. So they're asking us to do these answers with none of that data.
Well, I think some of that data is out there.
I don't believe so. Do we have that data?
Well, it's presentation.
Oh, no, none of that was shown. There was no data. There were some reports that was general talking, but not from Dillon, Montana or Beaverhead County.
There's meta-analyses of lots of studies.
And there's meta-analyses of country by country showing the countries that have, you know, implemented rigorous mandates. What? Australia is virtually free now, as is New Zealand.
Right.
I mean,
And they went through a wild shutdown. And it hurt them.
But they're virtually free now, and that's a big country.
But it hurt them. And here you're supposed to be looking at a strong look at, don't hurt the people economically. Don't hurt the people by keeping them out of schools. Don't do that stuff. And Australia did.
Well, we also don't want to hurt people by giving them diseases and having them die either. You know, that's a major goal.
Not disagreeing, but there's parts of life. I'm not for death, don't get me wrong, but it happens. And
it seems like the statistics are back and forth and hard at times to pull together, to prove or not prove. But let's look at Beaverhead County. We have had a mask mandate that we have all supported, and we supported it as this board. But we also know that not everyone followed that mandate. We run into people every place we go where some aren't. Businesses, some are following the guidelines, and CDC and DPHHS, and our board has encouraged. But not everyone does it. So it almost seems to me like it's almost an individual thing. I can say for me personally, I have worn my mask wherever I go. At the university, we have a mandate that you must wear your mask when you're in public, when you're on campus. If you're in your office by yourself, you can remove your mask. But in this year's time that we have had this mandate, my personal life, I have bronchitis, and I get bronchitis a couple of times a year. In this year, in wearing my mask, I have not been sick once. So I believe, for me personally, following these mandates, it has kept my health better. And I have been exposed to those with COVID. I have not had COVID myself, but I have been exposed. But I think following these guidelines, I think works, if we follow them the way we're supposed to. Now, there's going to be those that have followed them and they still maybe have gotten sick. There's lots of reasons for that. But I think the guidelines have been put in place that work if we follow them as closely as we can. So I think, to answer your question, do those things work? Yes, if you follow them completely. If you don't, they're not going to. The other thing, and it totally left my head, so I'm going to have to think about what that was. And Shar, go. Help me out here, Shar.
If I can carry the thread of what Nicole said, and I don't recall the numbers. Is Jeremy here? Yeah, Jeremy's here. Jeremy filmed when I did the push for doing videos on mask mandates. One of them that Jeremy got was Beth Weatherby. And I think we can take the university as an entity that they had better control on mask restrictions than we do as a population of Beaverhead County. And nonetheless, Dr. Weatherby said, and I may be stretching this because I'm going from memory, so Jeremy, if you remember better than I do also. But if I recall what Dr. Weatherby said, and that was we require masks, just as Nicole said, in classrooms, on campus, etc. She said where we have had outbreaks on campus is when students have met in private gatherings and violated those mandates. Am I?
That's correct.
So, here we have the university that really did a better job than we did as a community because they could put more stringent restrictions than we can. And they still had cases, but admittedly, or at least it sounds like from the evidence that Dr. Weatherby gave, most of those were traceable to violations of those mandates.
Correct. Either gathering at parties or being out in the public and working in areas that we didn't follow the mandate.
Because I think a couple things with those interventions too, I think we need to think of for the future is just in general our supply, and I think that's more for the county and for the hospital too, but I think what we realized is once this happened that we really need to work on our PPE supply. And I mean, we had that hand sanitizer we couldn't find, which I really think is still important. But I think that's one thing I'd like to put out there too, that we need to, reassess how many N95s we have on hand and things like that for future reference, because that limited us quite a bit just in the medical community.
I also think, I remember what I was going to say, is we have these mandates, but we don't have any teeth.
Right. That gets back to where we were last week.
Exactly. And so I think maybe that's some areas of improvement that we can encourage our city and our county officials to put ordinances together so that we can have some teeth behind this. And then the other thought I had was we want to make sure that our businesses can still prosper and be able to work through these mandates, these diseases. So maybe we could have had meetings with our business owners, and it may have maybe split it up with those in the food industry and those in other, and maybe there'll be other categories. But communicate with them. What are their needs? What are their concerns? How can we help them to be able to meet these guidelines or mandates, however it's presented to them, and have that open communication to help them to know we do care. And I recall when we did our first meeting and we were asking the restaurants, well, they were closing and it was only drive up or delivery outside. And we made the statement, this board did, that we need to make sure that we are still supporting those restaurants and we're going to them and supporting them. And I think we needed to get that information out to our public as well. And yes, our restaurants are closed and for going inside and eating, but they're still open for delivery. And let's support, let's help. And I think that goes a long ways. If this board is asking our restaurants to do that, but we're also saying, but use what is available. So maybe we could have done better there.
And I'm not disagreeing that we couldn't do better communicating to the public and everybody else on that. But like, we singled out restaurants and bars. Mm-hmm. Well, there's been some states, Montana is not one of them, that's actually did studies and looked into how many cases really did come directly from a restaurant or a bar. And it turned out, at least some of the states, the ones that did it, it was like 2.5% got them from bars and restaurants. And when you threw out the bars, it got down to 0.5% of all the cases were from restaurants. Yet we singled out restaurants and bars and pretty much locked them down totally. Where all these, so not all the other states, it shouldn't be, the states that looked at it found that that was not the cause. mainly the cost, 70%, came from family members. That's where, so we gotta lock down family members if you wanna do that, and don't let any of them see each other. If you're really wanting to stop, and don't let anybody come out in the public. That will lock it down and stop the disease spread completely.
I want to say something about that, because when you're at a bar, do you know everybody that's there? So if you come down with it, are you going to be able, that's where we're finding out. They have no idea. Yeah, I was at that. We had many people say, we were at the restaurant, we were at a bar,
And that's their only exposure.
and that's their only exposure. But they can't identify people because they don't know them unless they were with a buddy. So, same thing with
That's tough,
Safeway,
yeah.
that's what community spread is. You know, you go to Safeway, and I'm not just singling out Safeway, but you go to a grocery store, or you go to Walmart or whatever, you have no idea who those people are. So you can't say, you know, if you're going by, yeah, you were a direct exposure to somebody you knew had COVID, you're not gonna know. So I don't believe those numbers are accurate, just from personal experience doing contact tracing.
Yeah.
So,
Well, what were the numbers if you've done all that?
well, we can't,
should
Well, you
present it
can't
to
prove
us
that. Mike, you can't prove that. I mean, if you went, okay, so you went to a wedding, you went to a funeral, you went to a bar, you know, a week later you come down with COVID. Maybe you did all three of those things in the past 2 weeks. I mean, I can see how that would be difficult data to gather.
and just throw in one more thing, and with the Labor Day, the rodeo and everything, we were thinking about, well, if somebody comes down with COVID, then we'll just identify the people around them. Well, they didn't know who those people were, so we had absolutely no way of doing contact tracing. And we did have some people that, that was their only exposure was at the rodeo. So, you know, it sounded good with the plan, but to implement it, there was no way of even knowing who those people were. So.
Is it, Charlie?
I wonder, as a plan, I'm very sympathetic to the economic issues, Mike.
Oh, absolutely.
And I do agree that we may well have overshot early in the pandemic to shut these places down. We know more now than we did.
Yes.
And about schools, we know more now than we did. I personally think if we could manage to get individuals to more stringently wear masks, social distance to the extent they can, avoid some of those things, I don't know that we would have had to shut down all the businesses. And you're right, maybe, you know, it may come out as we gather more data nationally that restaurants are not a big problem if they are following the proper guidelines.
Right.
You know, there's all those caveats we've got to put in. Bars, in my mind, and this is just my opinion, are probably more problematic because alcohol has this tendency to release inhibitions and probably release masks and other things. So, you know, I'm not going to say much about the bars, but I'm not sure we needed to be quite as restrictive, but you only know those things in hindsight. We didn't know that at the time.
I think that's a really good point. We've been through this. It's like, we kind of know, like, maybe, yeah, we shouldn't have done that. And people had absolutely no idea what all this stuff means, but now they do. Now there's lots of research, there's lots of information out there saying that, you know, it does work. And so I think a lot of it was just the unknown and never going through something like this. That people were going, oh my God, you know, what? You know, let's just lock everything down, you know. But yeah, I think if this happened again, I think it certainly would be more of a, okay, let's institute these NPIs and
try to get everyone
monitor.
participating at that level.
Yes.
So we don't, and that's what we've been touting for the last
Yes.
month or two. You know, get them wearing, like you could pull up your mask if you're not speaking.
You're signaling me out.
I'm requesting that you abide by the regulations, yeah. Anyway, the point being that if people would abide by those, you know, as a community, by those simpler restrictions, we wouldn't have to put in place more stringent restrictions.
Now, I think you got to be careful. First off, have we even done a study to see how many people are wearing masks all around places? To me, lately, there's been quite a few. I would say 70–80% of the people wear masks. Now, I don't have numbers. I did not do a study. That's a number I just threw out. But we haven't done that. We don't know how many really are. You know, what is the number with all this years of data that we've gotten so far? What's the transmittability of COVID-19? You know, what's all these things? What's the, I can't remember the number, our number, I think there's something like that that says, okay, where's herd immunity? Because that's what vaccine even does. What's herd immunity? If masks work, if you hit 70%, let's just say, for example, if 70% is the number for herd immunity, and 70% of the people wear masks, and you know masks work, there will be very little transmission of the virus because you hit herd immunity. Herd immunity, all it's saying is people can't spread the virus. Okay, because they've had it already, or whatever vaccines gave it to, whatever, you can't spread it. So if masks work, 70% of the people wear it, or 80%, and the herd immunity number is around 70–80, there shouldn't be any more coming out now. Even though 20 don't do it, herd immunity, I mean, you'll still have a few cases, but it won't go wild. It won't, you know, escalate, go exponential. It'll kind of sort of flutter and still die out.
So
that's herd immunity.
Did you say you felt that people are wearing their mask more?
When I go to Safeways, I see quite a few wearing masks. I don't know the exact number. I said 70%. And I don't know what herd immunity, because nobody's wanting to say with all this year of data that we have for COVID, the people, the professionals are not saying it now. They're not looking at this stuff. I don't know what the number for COVID-19 on herd immunity is.
Well, I mean, the number is probably 70–85%. That's what experts think, but how do we know? No population has achieved it yet, right? So we probably won't know officially. And I think that kind of points to what we'll look for in the future too. I think we need to make sure we work on education a lot too, because we're probably going to have another novel virus pandemic, is my guess, within our lifetimes. And all that data will be unknown yet again. I mean, we can draw on other viruses' data, but I think we need to work on education and being as transparent as possible on what we know and don't know. And I think relying on the experts to help us with the things we don't know, but that's what I've heard, 70–85%, you know. So I think we do know a lot of those things. We just need to make sure we promote those experts' voices so that we know that we're all on the same page.
Okay. I have one person on Zoom, Kara Richmond, I believe, that indicated she wanted to comment. We got a minute. Go ahead if you have something, Kara.
Okay. Well, and I don't want to take too long.
Could you introduce yourself to the minutes? Could you?
Sure.
Is it Kara Richmond?
My name is Kara. Yeah, my name is Kara Richmond. I'm the disease intervention specialist with Sue at Beaverhead County Public Health. I've been here about 3 months. My master's is in epidemiology, and I don't have the report that Mayor Clacken just handed out to everyone in front of me, but I did want to make a couple of comments. That Kansas study that came out back in the fall, the thing that it really looked at when it was looking at mask-wearing communities was the rate of change. So if you had, and the mask mandates were, you know, well accepted in urban areas and less well accepted in rural areas. And they clarified very distinctly that these communities were distinct and different. But the thing that they really looked at was the rate of change. So, and that was why they picked windows of time. You know, it's just to have some set identified rate. So how many cases do we have during this window when we did not have a mask mandate versus how many cases did we have in this window when we did have a mask mandate? And it showed very strongly that there was a significant difference in the communities that had mask mandates. They did not count how many people wore masks. They did not go into the communities and say, are you always wearing them in schools? But they did actually show that there was a significant difference. So having a mask mandate, and the thing I didn't look, which Nicole Hazelbaker brought up a few minutes ago, is was there teeth in their mask mandate? Was there a fine if they did not have, if you did not wear a mask? I didn't look at that to see if that was behind these mask mandates. However, they did show that there was a difference. Fewer people got COVID where there was a mask mandate. And I have to say, I'm very frustrated that we're still debating masks. We have shown that you can reduce transmission up to 80% by wearing masks. That has been well shown. You can look at all the data in Australia and China and North Korea and South Korea. I mean, it's amazing what information is out there. And if we're going to still argue mask wearing, then I really do worry for our businesses, because that's what's allowed us to get our numbers down, because people are actually following the mask mandate more than they were, and it allows people to go out and spend money. I mean, you can't if you don't feel you can be safe in the community because no one's wearing masks. That's my only comment.
Okay, thank you.
May I respond?
Go ahead.
This will be the only comment I'll make. I don't believe that we have shown that these things work again. Look at California, look at New York. What states would you say out of this whole United States had the most restrictive mandates out there for masks, for locking down businesses doing that? I would say New York and California. I see the numbers on the plots I gave. Their numbers are not going down. They're still going up. The death rate is going up out of the sky for those states. It's not helping those states. It hasn't started going down yet.
However, you said you see more people wearing masks, and our numbers have gone down.
Again, some of those really densely populated areas, I really think you'd have to split this data out and look at it differently. I think in areas that you have that high of population density, you've got to compare apples to apples. You can't do blanket statements across the state, because there's obviously parts of California, parts of Texas, parts of New York that the population densities are much less. Maybe not as low as ours, but again, look at Hong Kong and some of those cities that have really high population densities that have implemented mask orders. I don't think we can use statewide data for that.
And you can, and I agree. And the same thing could be said on the Kansas stuff. They looked at these big cities and they grouped the big cities with the small stuff. We went over that. I showed you guys. That really biases the numbers. The Kansas study doesn't show what they showed.
I have one more. Carol Kennedy, who's the tech advisor to this. Go ahead, Carol.
I just in thinking of what has gone well over the past 10 months and what Beaverhead County has achieved, I think it's important to realize that how amazing it is that we have not had an outbreak in our nursing home. I think all the steps the nursing home put in place right off the bat has protected those folks. Certainly, absolute mask wearing, restricting visitors, as cruel and difficult as that has been, it has made a difference. We've not had an outbreak among our healthcare workers. We started everybody mandating masks right off the bat, and it has made a difference. Our hospital has not been overwhelmed with positive cases. We have had patients in the hospital. We've had really sick folks, but our staff has not contracted COVID. Even the folks who have died here, and that certainly has been hard on everybody, but it has not spread among other workers or the people taking care of those patients. I also think it's interesting that in visiting with the patients that we have had in the hospital, I cannot think of one who has been able to identify where they contracted the disease. Most of these folks were being careful. They would tell you, I haven't been anywhere. I haven't done anything. They have no idea where they got it. So I agree maybe some of the lockdowns were maybe not effective. We'll never really know. But patients were not able to say, oh yeah, I went to that wedding, or yes, I was at the rodeo. I mean, we were not able to identify those. But I think keeping track of the things that have been successful, we would want to implement those things again, and right off the bat, like we did last March. Thank you.
Thanks, Carol. Sue?
I didn't really want this to be a debate about wearing masks or not wearing masks. I just was hoping to, what could we have done better at the beginning of this, now that we can look back and see. And I think, like what you said, Nicole, is helping businesses better, having that open communication, because I do think that was kind of lacking, because it was just so thrown at us, and we don't have a communication public information officer with the county, and that's something I'm hoping that we can get, because that would have been huge. With us trying to figure out what we're supposed to say, and Tom Wagonet, I mean, we have a part-time DES person, and at that time a 3-person public health department. So kind of looking in the future, I think that's one thing that we need is a PIO that's been trained, and would definitely be a big asset for this.
And maybe that would have allowed us to get some of those public service messages out earlier.
Yes. We did set up incident command initially. I don't know what we could have done better. After a while, I felt like we were just saying the same thing over and over and over. So maybe an incident command was good at the beginning, but then maybe we needed to have some kind of plan to transition into the, what were we calling, tasks, when we just having the college and we, whatever.
Task force of some kind.
Yeah, some of the pertinent agencies getting together, and we started that, but again, it's the resource. I'm not able to be consistent with that, and either is Tom. So having a PIO would definitely be a huge asset, and something we can look at too.
And
bringing that on.
Public
information officer.
Thank you.
So with that said, do you think, do we have enough comments for you to compile a slow transmission of disease paragraph in your plan, whatever? Sue, and you're organized, can I move to number 2? Or?
Yeah, because I think they're all going to barely meld
I
together.
got one more
anyways.
comment, quick, George.
Yeah, George Warner, I understand your intent to manage something that we still don't truly understand. Sure, we know some facts that we didn't know 10, 12 months ago, but we still don't know all the issues surrounding this COVID. We don't truly understand how it's spread. And I illustrated this issue with the City Council back in November. The Marine Corps conducted a study, and it went from the Naval Medical to the New England Journal of Medicine. And in that study, they had a control group, roughly 1,500 people, and they had another control group. Each one had either no protocols or mandatory protocols with drill sergeants. The simple answer to what ended up after 2 weeks was if you followed all the mandated protocols, you had a 40% chance of getting COVID, more so than the non-control group. That's your apples and apples, Charlotte. And that's why I keep looking at how do you plan for something when you don't even know what it is. Now, certainly, you need to put something into the emergency and disaster plan. I'm not denying that. And you're looking at it from a proper perspective, going through the city and the county and doing this thing right. But how do you plan for something when you don't know what it is? I'm sure that Sue has done the best job she could. She's reacting to whatever's coming up, and she's doing the best she can. But how do you even help? 9 out of 10 of you people in here believe that the masks are effective. I don't believe they're effective. I also believe I was one of the first ones to contract it back in January. Okay, we're looking at policies that are going to say, I can't travel without immunization. Okay, what's the immunization going to do? It's going to give me something that I believe I've already had. How do you control this with laws, ordinances, when you really don't even understand the animal? And we probably won't for an extended period of time. There's therapies out there that are effective, and there's vaccines that are shown to be effective, but we don't know the nature of the animal. Thank you.
Yeah, I got one more quick comment here, and then we'll have to move on. Yeah.
I just wanted to add to the idea of how, as far as things that have gone well, to build on what Carol was talking about, was the collaboration that's happened in the community. I mean, that all just came to light and really proved itself last Friday at the vaccine clinic. The collaboration, having come to this late in the game, because I didn't start working until October, already there were agreements between community health and Barrett and public health and other healthcare providers in the community, and then with law enforcement. I mean, really, I think any mitigation that's happened and prevention and all the efforts to identifying cases and isolating and quarantining and then, social distancing and hand washing, and then the schools, all the work that's gone in has been incredibly collaborative, and I would congratulate this community for the efforts that it's taken and how well you all work together.
Okay. But I'm going to start.
Not talking about masks, I'm going to the next stuff.
Yeah, we're going to go to the second, number 2.
Yeah, or
Number
3,
2,
whatever.
We're going to minimize morbidity and mortality. And
Well, I'd like to, first, let's talk about schools too. That, I think what they've done was a good job on that. Actually, I think they've probably been more restrictive than they could have been, just from seeing what the numbers show with kids. I know not the teachers, they're adults, but the studies showing now even that it's less likely for the kid to pass it on to an adult. Not the adult to the kid, but the kid to the adult is what it's showing. Plus, their severity for the kids are almost null. It's not null, I'm not saying, but it's getting close. So really, we started worrying about protecting them from this one disease when other stuff came in. I mean, it's a pandemic almost now going around the country of suicide deaths. And I'm talking young ones, 10, 9 years old. They just can't handle it being away. Now, I'm not saying in Montana as much, because especially like Dillon, because we're letting it still more, but there's some places that's locked down schools and they're just doing online. And I don't like the online thing because I don't think that really does what needs to be done of bringing the kids together. Humans have to have social contact. Don't care if you keep a 6-foot distance, I'm okay with that, but they still got to be able to see the faces and talk, and interact with the people. And that's where I think the plan really should go, is you got to work on that. Now, I'm not saying influenza doesn't touch the little kids, okay? That's different disease, and I think we're supposed to cover not just COVID, but all the other communicable diseases. And then one other thing too, also to add on, I'm done with the schools. I think I'm not done with the schools, don't get me. It looks like when I read through this implementation guide and going through, I'm not totally against it, but I think we're supposed to be bringing in way more people than just the county health or city county health board. We're supposed to be bringing in a bunch of public members coming in. You're supposed to have all the elected officials, or some of them, to come on in because they're supposed to vote on it. You can't have an implementation guide or not guide, a strategy without the council and the commissioners voting on it. So are we going to give it to them, or is this not really an implementation strat or a community mitigation strategy?
You're correct. I mean, the more partners you can get, the better.
Yeah.
But this is a start. This is just getting an introduction on what's good, and then, yeah, I'd be happy to send it out, but it's nothing that needs to be voted on. I mean, none of my plans have been voted on that we have developed with, usually it's with our, oh my gosh, it just went out of my mind, our emergency. Thank you. Local emergency.
No. Planning.
Planning, great, great. That's how long it's been. We usually meet at least quarterly or more frequently if needed for that. And that's usually where we take our plans and do our planning like this, because we have partners from all over the place. But we haven't had those meetings since this started. And so this was a good group. This was an identified group that you could go and talk to. And so I thought, I don't want to do it by myself, because that's not the way it's supposed to be done. But it's a start. We do have people from the college and the hospital and law enforcement and the city. I mean, we do have some representation. So is it all inclusive right here? No. And you're right. You're right about that. We need to bring it out. But I wasn't looking for a vote, I guess.
Randy's had his hand up here.
Yes.
Well, since the schools were brought up, I would
Yes.
like to say, I agree wholeheartedly. I'm Randy Shipman, the superintendent of School District 10 here. I agree wholeheartedly with the mayor, and just every chance I get, I want to say that. And Sue has been great to work with, and Dr. Evans, as far as our school and being open. It is by far the best thing for our kids. We are seeing horrible things with our kids because of this pandemic. And the more we close them off and close them down, the more horrible things we're seeing. I'm speaking as a parent of 2 high school age kids. They need to be in school full time. I agree with the mayor, there's no reason that they aren't in school. We're not spreading the virus in school. As most of you probably know, we have 109 staff members, 12 have contracted COVID. Thank God they've all recovered successfully and are doing great. And we've had 26 kids. It's about equal from the middle school to the elementary. We have 440 elementary kids and 235 middle school kids. And it's been about half and half, about 14 and 16 or something like that. So I agree wholeheartedly with you and appreciate that. I am not a big mask person, but I do believe the masks are making a big difference. And I think that's why, we've seen a lot of our sicknesses in schools go down. I agree with Nicole, what you said earlier about your personal thing. I think we're seeing that too. I do have a quick question with all the experts in the room and up there, if I could go back to masks real quick, since we're on it. And I believe the study is the one that was presented before, that Kansas study that keeps coming up. There is a very interesting thing, and maybe it'd be a great argument for the medical field to use. I just don't understand it. I'm not a doctor, but in that study it says that if you have a mask on and you get less aerosol sprays, that you don't get the disease as bad. That makes zero sense to me, because when I get a sickness, it goes into my body and it mutates, and the first day I feel okay, and the second day I don't feel as good, and the third day I feel worse, and pretty soon I feel really bad until my body fights that off. So if somebody could make sense, Dr. Evans, Sue, Kara, Charlotte, Carol, somebody in the medical field, if somebody can make sense to me, I think that would strengthen your argument about masks. I, like Sue, have been very healthy lately. I think it's partly because I try to wear it as best I can. We certainly promote that here at school, and our school has been very healthy because of that. But it makes zero sense to me from a medical field how if I get 1 aerosol in me, or if I get 10, the 1 I'm going to get less sick, and the 10 I'm going to get more sick. Makes no sense because of the way I understand disease in the body. Sorry.
Yeah, I think you have to sort it out into inoculum, which is the amount of virus you're exposed to, and then the viral replicating dose, the viral load. So inoculum is how much you're exposed. your body can bind it with maybe some killer T cells and it's gone. You don't even know you had it. But maybe for you, if you had 10 particles exposed, then you would get sick, okay? So the inoculum is different for each virus, each person. There's actually really good data that decreasing the inoculum decreases your risk of disease. It's been studied in animals for decades, and you can probably corroborate it, Charlotte, but it's well studied in other viruses too. So we know that a decreased inoculum decreases your likelihood of getting disease. Now, then the virus replicating in your body, that's a totally different story, right? Because it's replicating, and that's really what viral load is how much load you're carrying. There's some data that shows that a higher viral load can change how sick you are, but I don't know that it's totally well understood. It kind of makes sense if you have a higher viral load, you'd be more sick, but I think that data isn't as good necessarily.
I think there's a lot of individual variability
Exactly.
in terms of the innate, your own body's immune response to whatever viral load, but it's a numbers game initially.
Yeah.
Well, if that's true, because when I get something, I get it bad. As Dr. Evans knows, she's with I. But if that's true, it's a very strong statement for masks. If it is true, and they're talking about 2 masks, and if that's true, that's a very strong statement for masks that the less you get in, the healthier you'll be. Anyways, I appreciate the time. My biggest point was, I agree wholeheartedly with the mayor that our kids need to be in school. We're very proud to say we've been in school in person 5 days a week from the start of the year, and we're doing quite well, and our kids are doing better because of it. And I appreciate
Randy,
all of your guys' efforts.
one question. So, like the university, have you been successful in getting individuals when they're in these buildings to wear masks and abide by the rules?
Yeah, we have a mask mandate, and I can't say we're perfect with it, but I think we're pretty darn good. I definitely walk around and have to remind folks, and our teachers have to remind folks. Sometimes we have to remind our teachers and things like that, but I think by and large we're doing quite well, and I think that's the reason we're doing well. I will say though, it's not perfect, and it does lend further evidence that our playground is one example. We're not as good out there. We have kids bunched up. They're not supposed to be, and we work on it. But they're still not spreading it as greatly. And so I think there's a lot to be said for kids are not...
They wear their masks outside?
Not if they're 6 foot distancing. Okay. They don't have to, and if they're playing. But for the most part, we do, and we do well. And you'll see as you leave here, you'll see the kids. But you'll also see the violators.
Okay. Yeah, thanks.
Thank you.
Thanks.
I also wanted to, I keep hammering masks, okay, but I think the big factor, and even myself, I wash my hands. I don't touch my eyes and my mouth as anywhere near like I used to do. I think a lot of people have changed that. And what some studies are showing, that's how this thing gets transmitted the easiest, is they would have some hit the table or something, and then you get it and you scratch your eye, or you put something in your mouth or something, and that just, off it goes, And that's what, maybe the kids, they're washing their hands more often now or something. I don't know, or not just washing hands, but the antibacterial,
hand
sanitizers.
I do appreciate the mayor saying it, because we have really buckled down on all those things. So I think the mask is definitely a piece to it. The social distancing, I think, is a bigger piece to it. And then, of course, the hand hygiene and all those types of things. We have tried to do a much better job with all those mitigating factors. And I think I don't think it's just the mask for sure. Yeah, it is all that other stuff.
Yeah, it's kind of like myself. Grandma never told me to wear a mask, but it was wash your hands, don't touch this, don't touch that hand railing. All of that type of thing was really common when I was young. Yeah. Sue.
I'm talking about schools, and I just want to reiterate all of it. I'm sure I can speak for everybody. We want our kids in school.
Yeah.
That is absolutely a true statement. And again, now that we have this data, something like this happens again, perhaps we can approach it differently. I do want to say we've worked so closely with the schools right in the beginning. But from your perspective, looking back, Randy, what could we have done better? with this, working with the schools?
I'm not sure. I think you've done a phenomenal job, Sue, and I have to include Dr. Evans in that, and Gary Haverfield at the high school, and my principals, Greg Fitzgerald and Joel Rogers. We have all worked very closely, and I think, like I said, and I don't want to, we're a different district than the high school. What they have to do is what they have to do that works for them. What we do is what we do. You have been supported from day one. We've been, as I said, in person 5 days a week from the very, very beginning, and Sue has been very supportive of that. She has asked us to do certain things, and we have, done those to the best of our ability. Of course, we have a good board of trustees that obviously make the final decision. But I don't know if there's anything different. There has been things like wrestling. We are doing after-school activities for the most part. We're trying to use common sense. Sue had some concerns about wrestling. I shared those concerns. Our board shared those concerns. And so terrible for our wrestlers. We don't want to limit activities for anybody, but we're trying to use some common sense and make sure that our school stays open and we're able to do most of the activities. I know the high school is wrestling and they're doing pretty well. I know they had one case and they didn't have a big outbreak. So we took that under consideration too, but I don't know that you could do anything better. I think you've done a great job of working with us and helping us. I am glad that I think last spring we all panicked a little bit. Not just Sue, me, everybody. We all panicked and we closed down, and maybe in retrospect we didn't need to. And I think that hurt us. That hurt our kids. It hurt our profession. We've gotten a lot better with how we deliver instruction to our remote kids now. So in a way, it was a good learning experience. But I'm not sure you could have done anything better, Sue. I think you've done a phenomenal job and supported us. We have been pretty adamant. Sue and I have butted a little bit sometimes. Just she has her public health to worry about, and I have a school to worry about. And most of the time that jives, and sometimes it doesn't. But I've really appreciated working with you, and I don't know that there's anything that could have been better, other than the knowledge we have now.
Right.
Thanks.
Thank you.
Incentive that we complete that topic, minimize morbidity and mortality. Are we there?
I think those 1 and 2 are pretty much.
Yeah, they kind of go.
They go together.
I guess could I add just maybe a
Go
couple
ahead.
things on there? I mean, I think one thing that helped with in our community is the hospital had a lot of foresight in getting a PCR machine many years ago. So we were actually ahead of even larger communities of getting testing here. And talking about the BioFire and the Cepheid machines. So I think that's been really lucky that we had that investment already. That sped up a lot of things as far as testing. And then I think kind of another thing that we probably need to work on, but I think was helpful, was our telehealth capability. I mean, I think that did decrease morbidity because people were still able to see their providers, but I think it's still a work in progress. And I kind of think it goes along with remote learning too. We have a lot of difficulty with the technology and just frankly our internet speed. That's silly, but if we had an improved, not just speed but access for patients too. Some people don't have the internet at home. I know that's a big statewide issue, but I think that could really help our response too, is just more access for families and for patients across the board for telehealth and for learning. So that's a bigger infrastructure investment that I'm not certainly an expert in, but it would help.
And this PCR.
PCR, polymerase chain reaction. It's amplifying DNA.
Oh, okay. All right. Every profession has their angle.
Right. Probably means something different to you. Not
Okay.
I just want to add on with what Dr. Evans was saying with telehealth. The university, through our counseling department, a year before this all began, implemented telecounseling for our students, for those that are our students and maybe out in the field doing internships or student teaching. And we knew that our students still needed to have that opportunity to speak to a counselor. So we implemented that about a year before COVID came in. And then once COVID became a part of the university system, all the other campuses decided to bring in telecounseling as well. And of course, there's those growing pains when you do that. But our campus was a year ahead, and we didn't have any more of those hiccups, and we were able to take care of our students through telecounseling, which was very important and helps with a lot of the mental health issues that we're all concerned about. And so I think, that's one of the, it does work. And for the telehealth, it does work. I know we had a student use telehealth yesterday with you, and how that was huge for that student. So I think we keep going and moving forward with our telehealth and telecounseling and keeping that at our front, even after we're done with this pandemic, because it's needed. And that internet issue is also something we've got to get figured out.
I'm going to move on to 3, is that right?
It's pretty much all the same.
Okay, I'll just say for we're in to preserve healthcare workforce infrastructure functions and minimize social and economic impacts, which is kind of the summary of what we've been talking about. Okay, but go ahead.
So I wanted to go back and kind of touch on what Nicole said. Other things that we've started to do, the telehealth, the telecounseling, with the schools, learning how to do the online. I know that was a huge issue. And the high school has implemented their, what would you call it, Randy, where it's in class.
Their hybrid schedule.
Yeah, but when they're not in class, they're participating in class.
Remotely, yeah.
Yeah, a remote. So they didn't have that before. So I think those are, what's come out of this are good things that we have now. Another thing in our toolbox, they say, that we can pull out and now use for things. Let's, whatever, a kid breaks his leg and can't come to school, I don't know, there's those options now that are out there that perhaps we didn't have, or it wasn't, weren't able to do it well, those kinds of things. So in thinking of that, and looking at this economic thing, what do you think has come out of this pandemic that they found out it worked well? They had to think outside the box, that it worked well, and it's something that they can use in the future for perhaps not a pandemic, but they can institute it into their businesses.
Well, so many businesses have expanded online presences, and that's been huge.
Yeah.
And that, too, was a learning curve for many businesses, and I guess that's the one thing you can suggest to businesses that have not done that they perhaps need to consider those options.
A lot of businesses, though, are not set up for online.
Well, that's what I'm saying. They may have to.
A lot of them. I mean, there are some. I would really, though, highly recommend that you do not teach with tele-teaching, whatever you want to call it, or tele-instruction, if you can't get away with it, or get away from it. I can see it, but man, you still, like I said, you need the interaction, and you don't get it over online. In fact, I think you actually reinforce the opposite. If you stay off, you're sort of leaving everybody separate,
Well, just my experience, I teach at MSU, and last spring we went online, and my class average, and these are first-year veterinary students. They're motivated, they're good students, and the class average over the second half of the semester compared to the first half dropped by 10 percentage points. And these are bright kids.
Yeah.
And I told MSU that if we were online this fall, I wasn't going to teach. I don't think it's effective. Right. Well, especially what I'm teaching.
Yeah.
I guess in terms of preserving the healthcare workforce, one thing I've been worried about is just the public health workforce with burnout, and it's just been a really difficult time. I don't know if it's been the best recruitment for public health, but I mean, we do We do have Montana Public Health, is it the Institute?
Yep.
And then we do have a master's program in Missoula now for people to get their master's in public health. So I don't know if there's a way we can, promote that within our community. I mean, we do have more people who have trained to be contact tracers, which is really helpful. And so maybe they can be tapped in the future if needed, but I think that's something we might need to look at promoting that field. Epidemiology, all those kinds of things. Or maybe you have some ideas, Nicole, from a college perspective, but I do worry about that workforce.
Okay. George.
I wanted to illustrate one of the economic impacts that's occurring in our community that most people don't see. In my business, rebuilding engines, I've been ordering what we call master kits for engines, all the specific parts. The last 2 engines, half the parts aren't available through the biggest distributor in the country for engine parts. I've had to pick things up off of eBay just to build engines for local ranchers, farm trucks. The 292 Chevy that I'm currently working on right now, pistons weren't available, rings weren't available, camshaft wasn't available, gaskets, the basic gasket kit's not available. So I had to go scrounging to find this, like you're going into the junkyard to find brand new parts. This is going to get nothing but worse. And there will be a time in the very foreseeable future, I would say a couple months, the scrounging's over. We won't be able to repair these machines to keep people in the field. So one thing that's unseen by the public and us also is that this is coming. It's gonna be here rather soon. And there's no answer. We can't do much about this except, make people aware that these things aren't gonna be available. So I just wanted, on the economic aspect, it's coming.
Okay. I've heard that too. I mean, if you need a piece or part, it's more of a search than it has been used.
On any part.
Without a doubt.
Not just engines, but...
Oh boy, in any profession.
Yeah.
You bet. Supply.
The biggest problem is because we relied upon China too much.
Okay. More comments on, any more comments on topic number 3? Anyone? On the Zoom land, do we have one?
There's 2 chats, what's that?
Is there a chat?
Oh, sorry.
They're old ones? Okay.
Okay.
We got that. Sue, go ahead.
Just thinking on the infrastructure functions, as far as our governing bodies, I mean, we do have the mayor and we have a commissioner on the Board of Health, but what could we have done better with our governing body? Did they need more education up front, what was going on? Did there need to be more support from our governing bodies right at the beginning? I mean, I don't know. I just throwing that out there because I know that's an issue in some other communities.
Well, truthfully, I didn't want to interrupt you.
Go ahead.
I really think if the board here tries to make a decision, then they should assign somebody to come to council or to the commissioners and explain exactly what that was and what should we do to try to help you if they deem that it was what the public wanted in their eyes, because really this board doesn't have the power. The council and the commissioners have the power, and they can do these things, to put some teeth in it, but they gotta agree and they'll hold meetings and that. It's not a fast sudden thing.
Series of public hearings.
Yeah, but it wouldn't be bad. I'm not saying every week. Okay, not at all. But especially like when this board makes a decision, a big one, that we know is going to probably interrupt or change or do something to the public, wouldn't be bad to send somebody there to explain what's happening or what's going to happen, why did it have to happen.
Yeah.
That stuff, just to keep the communication. Or if you said you're getting a
Public information
Yeah, the
officer would have
information
really
for-
helped that.
Yeah.
That point, I think, is well taken. Mike.
And BIO for that, and then, and that, all of that, speaking ordinances and laws and that type of thing, and that, there's 12, 13 public health bills in the legislature right now. They're going in and out of committee, back and forth and being written. And, when that all comes to a head, then you'll know your position for the next time.
Yeah.
Because that wording can change, things like that, for the better or for be more confusing or less confusing. Right now, there is some that are confusing. They almost do this, bang on each other. So we'll just see how that goes. There again, it's a learning experience on that end also. They had to put something in place that all of a sudden now it doesn't go together. So now they're revising it, which is business. I look at it that way. I've been self-employed all my life, and I learned the hard way and the expensive way, and both more than once. That's kind of the way I look at it. So, yeah.
From the commissioner side, Tom, what would your thoughts be? Sort of the same thing, Aaliyah? I think that's a good idea.
Well, we have
actually.
general discussions and things like that, and even common. We're open to the public all the time, very time, and press is there all the time, and this type of thing. But if it's something that you have time and you make the time to do it quickly, you have a public hearing or a meeting, just a public meeting, and you take in comments and go through there, and then you re-meet again to kind of analyze that at least once, and that's a better feeling in the public for what the decision that's going to take place, and a better feeling for the commission, because everybody lives in their own cocoon, if you will. And you do it that way. But I'm all for a public hearing and a public meeting, and people in different professions, and because you start to make a decision and somebody says, oh, by the way, will that affect this? And then I forgot. That's the best thing. Spontaneous movement is sometimes damaging, very much so.
Unfortunately, sometimes you have to make those
You gotta-
fast decisions as
sometimes
a
you
health
gotta-
board.
Yeah, you do, but it's.
Yeah, but,
goes with
yeah,
it.
I agree.
We have one comment from Kara. Go ahead, Kara.
Just really quickly, I think this idea of communication back in July, August, September, and so, so being open to different forms of communication, having good internet, those things are really helpful, so that interface can be as personal as possible. But again, asking public health workers to come attend a meeting where no one else is wearing masks is really, I think, jeopardizing our feasibility of continuing to work. So, I guess I'd throw that back out there too, as you think about how communication could have been better. I think just being receptive to what was available, and as far as electronic communication versus in person, and keeping in mind that there were definitely limits to being able to meet in person.
Okay, thank you. Any other comments regarding 1, 2, or 3? Go ahead, Sue.
Of course. I have comments. Well, actually, I have a question. Okay, so this is something that none of us thought or even dreamed would happen, was the buying out of certain products at the beginning of the epidemic. So toilet paper, cleaning wipes, what else was there? Paper towels, all that kind of thing. How could that, that was a big, it sounds silly, but it was a big issue. Mm-hmm. How do we approach that if this happens again? How can we be more ahead of the game, I guess, in that. It was so, we still don't know why the toilet paper sold out. I don't know, I still don't
Well,
understand.
they all been worked on by the grandmothers that you never can run out of toilet paper.
Yeah. Some of them still have the pink toilet paper.
Yeah.
When I was a kid, we went to the grocery store once a month. And then there was this kind of a stash, if you will. There was always, of course, we live a little ways out of town, but still, they just wasn't, their society today is they're in the grocery store 2-3 times a week.
Yeah.
Maybe 6 hours, maybe the day or two, and then they buy the meals, and then they go back again, or something, I don't know. You know, it's just a different makeup than the older. I almost said it, Charlotte, the old days.
And it'd be hard to do, because what you would be requiring is all these businesses that you want that might run slow, you require them to have a big stack in the back, which they don't want to do because they get taxed on all of their inventory.
Yeah, big inventory costs a lot of money.
Yeah, and so they would have to have a big capital investment at the beginning to keep them in there, and they're not, I doubt they were gonna do it. Nobody's gonna do that anymore. And so I don't know if there's a fix, is what I'm
You know, and
trying
I
to tell
think
you that.
the freights was tied up. Everything was mixed up and tied up in the suppliers, and then at the production factory, we ran into that with the famous Kerrigan Lane issue out south of town, being rough. We ran into it there. Go ahead, Randy.
It would seem like there are some answers to that. I think it's a great question. Tom, I think is still in line. He could probably help us, but our federal government is supposed to do that. It's supposed to have a supply of things. And I would think our local people could do the same thing, whether it's toilet paper, but things like hands. I mean, like Dr. Evans said, we probably are going to have another novel virus here at some point, and going to be going through this again. And so, what are those things? You know, hand sanitizer was a big one. Obviously, toilet paper was a big one. Wipes, things like that. I would think that, and I get inventory and all that. I mean, we do that here, but I would think that is what, like Tom, is Tom still on there?
Not that I know.
I would think that is exactly what, Tom, there he is there. I would think that's, Tom might have some insight, but I think that's a great point. I know that we had to share things with the nursing home over here, and we didn't have enough. And I mean, in a way, it was good that school was canceled in March. We had ordered, we had plenty of toilet paper. And then the problem there is that our toilet paper only fits in a certain, we have certain dispensers, and same with our hand sanitizer. But I think it's a great question. But I think that is what we're supposed to do as a county or as a community, is to have a stock of those emergency basic items. But Tom might be able to share.
I don't think Tom's there. Can I share?
Go ahead.
So I know, and I think this falls under Tom, is that there's FEMA has out on their web pages and have promoted what they call 72-hour kits and food storage. And I think that there's religions that promote that as well. And so those things are already figured out. And I think whether it comes through public health, which may not be it, could be through the LEPC or through Tom, through DES, that we get that information out to our communities about food storage, about 72-hour kits, in preparation for whether it's a pandemic or it's a flood or it's, an earthquake. We have things in our homes. I think it becomes a personal responsibility and something we do in our homes. And so there is a ton of information out through
again,
some religions
just
and
education.
It's education, exactly. And
I hope could bring that up.
FEMA has all this stuff that's available to us, so we don't have to reinvent.
No.
It's there. We just need to have that information, the communication, and the education out to our community.
We have promoted that for years. I think it was just, that's a good idea, because it didn't impact them, but maybe now.
It means something now.
Yeah, it means something, and I think that's exactly, because we have been promoting it. We've done those kinds of things, but, people just kind of, that's. Do I have a 72-hour kit? I'm embarrassed to say not put together like I promoted.
Yeah.
So, yes, I mean, that's, hopefully people's eyes are opened and that they can see now the importance of having a thing of toilet paper.
Well, I have a month's supply of toilet paper.
So we
but
know
that
where to come.
But that ran out. And then you go to the store and it was bare. And how was, because they got rid of a lot of the people. It was not an essential service and they got rid of them. You know,
Yes,
saying,
that's true.
okay, stay home, don't be
Yeah.
infected.
Yeah.
And so now you didn't have any product being made to be sent out, even though the truck drivers were all driving, they didn't have any to deliver. And that took months. And so the only way that all can work, and I don't know if, usually like a pandemic, if it was just local, like a local flood, then you can bring in from all around the state. We can always get stuff in. But
Maybe.
it's really tough with a pandemic. It don't take, even though I know we keep a supply of oil, the nation does, but you just totally shut off everything, it doesn't take long to run out of that. You know, then what? I mean, well, you're talking about 2 weeks to a month is what you're gonna run on that, and if it lasts longer than that, you're all SOL. You really are.
And
So-
I use that word so I didn't cuss.
Quick, George.
It'll be quick.
Okay.
Another commodity that we're kind of ignoring that's as redneck as it gets is ammunition.
Yeah.
I mean, look what they did in Butte here a couple of weeks ago at Murdoch. They had police officers on each end of the line to restrict people from 2 boxes, and they got a fight. They got into a big fight there. So that's another aspect of, I don't know how you'd regulate it, but it's real.
Well, I think that goes back to the clinic that Sue put on and the planning that took place and the practicing that we did prior to
Last
this. We
many
had this
years.
pod already in place, the planning was there. And we saw in other communities, other states, where there's people pushing and trying to get that vaccination before somebody else. And Sue looked at her information and she realized we need to have law enforcement there. And thank you, law enforcement,
Yeah.
because there wasn't a problem that I'm aware of, but their presence was there. And it was so appreciated with all the other people that helped out. You know, there were, 26, 30 volunteers that day. And being on the university campus and watching this take place, we didn't have concerns. And people going to classes and working on the campus have made very positive comments of how they appreciate the organization and how it went. And they recognized there was law enforcement, and some of the people were like, why is law enforcement here? But then we need to educate on our campus so they understand why we've done this for the community. But law enforcement is huge, and so thanks, Donnie, for providing that for us, wherever you're at.
Okay, well, I mentioned earlier that we're gonna try to be out of here about 1:45.
Oh.
So we drift out of the halls, beat some of the classroom rush and that kind of thing, you know. So quickly, I'll go down through old business. I'm just gonna ask for approval of the minutes for the January 20th, 21 meeting, 2 o'clock over at the courthouse. the last
So
one.
made. Make the motion to approve.
Move to approve. Is there a second? A second on that. All in favor say aye.
Okay, can we add one thing? That we added the people that were there, and I know Mr. Warner was there in the meeting, just add his name as under the who was there.
Okay.
Because you had the press and that there.
Okay.
Yeah, okay.
Other than that, I'm okay with, that was
Okay,
the only
is it-
change.
Did I get a second?
Thank you.
I did, Charlotte.
Yeah.
Okay, I have a first and a second with corrections. All in favor say aye.
Aye.
Aye. Okay, that passed. And then, I'll leave that alone, new business, I don't see any, but, and that, next meeting, should we just make that tentative? We'll send that out if needed. Is there a draft, one question, on this, community intervention implication plan? Will there be a draft to go out to each of us just? to
Yeah, I was
glance at?
yeah.
Okay, so.
This is not due until April 15th, so
got plenty of time,
Yeah.
but when that, sometime before that,
Yep.
get a draft out so
How
we
about
can glance at it.
have a meeting in the middle of March? And then I'll make all of the vaccinations, first and second round done, and you can tell us what you've seen from all of that.
Okay, and at that time, I thank Randy again for offering this space, and I'm not sure that we're taking applications upstairs, clerk of the court, to get a tech person in the clerk of the court to run the Zoom and do all of that. And so if that happens and that works, I won't be knocking at your door again, but I very much appreciate today.
Well,
We're
nice
happy to
room.
host you. It's an
Yeah. And
important
then-
public deal.
Yeah. Secondly, then, we're tentatively will go in March, we'll set that date later, or look at your phones, but I will ask for some more public comment. George has got his hand up prior to the journey.
Very quickly, the way this regulation was initiated was by presidential order, March 13th of last year. Both Governor Bullock, which his order ended upon Governor Gianforte, keyed upon President Trump's order. 90 days, this is according to federal law, 90 days before the end of the year, because it's valid for 1 year, President Trump had to reinitiate. I don't believe he did. This process will be over on March 13th. And Governor Gianforte either will have to issue his own, President Biden will have to issue his own. He can't key off of Trump's because it had to have been done 90 days before to extend it. So I want everyone to be aware that this process could end or change on March 13th. That's only 5 weeks away.
Okay.
So everyone should keep themselves informed and look and see where we're at. I don't want people thinking that it continues just because. Thank you.
Okay, thanks, George. Any other? Okay, this next meeting, is there I see people looking at their phones, is there a
What's our,
date?
what's our regularly scheduled meeting? Isn't it in March or April?
I don't know.
Of course, I did not bring my whole big book
Yeah,
with
I
me.
think it's one of those, and I would suggest just during when we're supposed to meet again, which is March or April, I can't remember. I think it might be April. Do you think that's too late?
Well, it depends on if you get that draft up to us. If you want to rediscuss, if anybody's got any changes and back and forth, that's comments, this draft of this plan.
Yeah.
It's up to, doesn't matter to me.
Whatever.
She was saying she just was gonna send it.
So, yep, we can shoot emails around as far as the time and the date. There's certainly something like that. Go with that. Is there anything out there that's overlooked today? Pretty quiet. So with that, Randy.
One last thing, Sue, you asked earlier about what could be done better in that thing. Right now, I think everybody has a really good handle on everything, so I don't think the meetings matter. But I do know in the beginning, more meetings would have, I think, been more important. Especially, not just from a personal standpoint, but from schools and things like that. Because, and I heard that a lot from parents, that they're just, they didn't know what was going on. So that would be one thing as you're talking about meetings right now. I don't know if it matters going forward as much, but in the beginning, it seemed like there was a huge gap, like 3 or 4 months at one point between meetings, and I mean, I have Sue's cell phone number, so we were good, but I know I heard that a lot.
Yep.
That's a good point. Okay.
Carrot put in there.
No?
Yeah, Kara did put a messenger.
At the very bottom, Kara,
Right here.
Gianforte renewed
Down
the
the bottom,
emergency
way at the bottom.
declaration
Oh,
in
down
executive
here
order.
from Kara, Governor Gianforte renewed the emergency declaration in Executive Order 20-2021.
Yeah, he renewed President Trump's executive,
Is what it,
because the other one went away,
Or
the
maybe-
Bullock's went away.
I said that wrong, Order 2-2021.
But that will go away. If the
Okay.
presidents go away, he loses his power.
I think.
Because the governor only has, unless the president declares a pandemic or emergency, not a pandemic, emergency or disaster, the governor has 30 or 45 days and then it goes away unless the legislature approves it and extends it. Otherwise, it's over.
I see.
And that's what happens is, I've looked into emergencies and disasters a lot. So without the president, it all goes away very short time.
Okay. Point well taken. Okay, if that's the case, motion to adjourn?
So moved.
Second.
I won't vote. I've never seen one denied.
Yeah.
Okay, thanks again.